and CEO, Stormont Vail. Steve Anderson, CEO, University of Kansas Health System, St. Francis Campus. Dr. Cooley, Shawnee County Interim Health Officer. Mayor Michelle De La Isla, City of Topeka. Craig, you want to go ahead and start us off?
Thanks, Amanda, as always. And thank you, everybody, for tuning in again this Thursday. We appreciate everyone who shows up for these Thursday press briefings. So as typical, we'll start off with just an overview of the numbers here for Shawnee County and then move through into the scorecard and some couple other short updates today. So the total number of cases reported and assigned thus far to the health department for January is 2,602 cases. This does include cases that were reported to us this morning. This week we have had 454 cases reported so far, which includes the 82 cases that were reported and assigned to us this morning as well. So with that, we're averaging 124 cases a day over the last 2 weeks. Yesterday, after seeing a slight dip in numbers for the day over the last week and a half, we did have the highest number of cases assigned to us, 161 cases, and that was the highest number of cases that we had seen in the last 12 days from the period of 3 days where we saw cases reported above 200. Deaths, so far this week, we have had 2 deaths reported to the health department. That looks at 63 deaths that have been reported to us over the last 3 scorecard reporting periods, which would be December 27th through January 16th. This is representing about 24% of the total deaths, 265, that we have had since the pandemic began. So, okay, the next piece here, we'll go ahead and move into the scorecard, and I will share my screen. All right, so what you'll see here is the scorecard. We did have an overall decrease in the summary index by 4 points, moving from 23 to 19. This does, however, keep our community in the uncontrolled index again now for the 12th straight week. Several measures, however, this week are showing encouraging trends, shifting us from the negative trends that we had been seeing over the previous 2 weeks. So after a reporting period in which we saw the highest number of cases ever diagnosed in a week, which was the 1,129 from the last reporting period, we saw cases decrease 33% to 752 cases for this reporting period. So the overall number of cases, though, remains still very high in that uncontrolled level. We need to see that number come down another 77% to 175 cases or fewer for the outbreak to truly be considered under control and move us out of that uncontrolled that you see there on the screen. Pressures on the hospitals during this period continue to be high. Occupancy did bump back into that uncontrolled range just over the 90% uncontrolled threshold there at 90.1%. As you'll see here, we did have the 21 deaths that were reported during this weekly period. Those made up, as I mentioned earlier, a portion of the 63 deaths that had been reported over the last 3 scorecard reporting periods. So again, to clarify, the deaths are not a component of the scorecard itself that goes into the summary index that you see there, but we thought with a lot of requests of making sure that we had that data available. Percentage of positive cases have dropped. You see here into the high level at 8%. That's a sign that we see that hopefully less virus is circulating here in our community with those positivity rates, but we are still seeing a lot of virus in our community, evident by the high number of cases. So, but that is an encouraging sign to see when we see a number that is dropping below that 10%. Pressure on the public health system remains to be in that uncontrolled level. Now for the 4th straight week, we're having a lot of, as I'll get into next, the ability to not contact all the cases that are being assigned to the health department. With that, I think it's always important to always state that vigilance must continue to remain high at this time. The mitigation strategies that we have in place should stay there to help avoid any further deterioration of the situation here in Shawnee County, and hopefully continue to see some positive trends moving forward that we saw this week into the coming weeks. So. All right, as I kind of mentioned there briefly, with the public health system still kind of being uncontrolled, we have, however, seen a slight increase in our ability to make contact with positive cases. This partially is due to the lower number of cases that we had during this reporting period. So we have been able to make contact with roughly around 80% of the cases that have been assigned to the health department. But as we've been talking and preaching over the last 5 to 6 weeks, due to the continued high number of cases, we're still not able to make contact with every single individual who has tested positive in our community. So we encourage the following steps for all those folks who have tested positive here in Shawnee County or in the surrounding counties as well. If you receive a positive test, take the following steps. Severe symptoms, call your primary care provider, follow their directions. Always call ahead before you go to your doctor's office or the emergency room to understand what their policies are that they have in place. Isolate yourself in your house and from household contacts when possible. Isolation should last at least 10 days from the date that the symptoms appear, or if there are no symptoms, from the date that the laboratory test is performed. Additionally, helping us with the contact tracing component, we ask that people make a list of everyone that they've had close contact with. That again is the 10 minutes for 6 feet or less, starting 2 days before symptom onset or your positive test result, and to help us by notifying those individuals of their need to quarantine. So additionally, kind of building on that, the ability for us to not contact anybody. A couple weeks back, or not contact everybody, but a couple weeks back, we had announced a partnership with the City of Topeka's Division of Community Engagement. This was a partnership through their application to the AmeriCorps to receive additional volunteers. Those volunteers, as a part of that program, the health department is going to receive 9 volunteers. We'll have 5 full-time volunteers on a daily basis that will assist our process in doing case investigations. We are excited to announce that those volunteers actually started today. They're going through some training to do those case investigations, and we'll be starting really in earnest with those investigations next week on Monday. So excited to have those folks on board, and excited to see how we may be able to use this collaboration to reach 100% of the cases that are assigned to us, assigned out to investigators, and make contact for that investigation as well. The next piece is to do another update on testing. As we have over the last several weeks, we still have 3 locations that are currently active here in Shawnee County that are operated as Well Health, by Well Health, as part of the state's Stop the Spread, It's Up to Us Kansas campaign. Those sites will right now continue through the month of January. We do understand that there are conversations at the state level to determine whether or not those testing locations will be able to continue into February and maybe beyond. Those sites are at Hummer Sports Park, New Mount Zion Baptist Church, and the Topeka Shawnee County Public Library. Operational hours are Monday through Saturday from 9 to 5:30. These again are free saliva PCR tests for any individual regardless of the symptoms, and there are no age minimum for those as well. Since the inception of this program and this collaboration, there have been 13,081 tests conducted at those 3 sites here in Shawnee County. So as always, if there are, because we're in kind of that weather season for winter weather, if there are any weather delays or closures, we will be announcing those as part of our social media channels once we get that notification from Well Health. The last piece for testing that I wanted to talk about is a couple weeks back, we had launched an initiative to make free test kits available to employers and organizations here in Shawnee County to supply saliva PCR tests to their employees free of charge. Thus far through that program over the last couple of weeks, we've been able to provide just over 2,000 tests to local businesses here in Shawnee County. As a reminder, individuals can go onto our webpage under the COVID-19 information and go to the testing options page. There's a quick survey. It takes about a minute or two to fill out, to put into a request for those supplies, and a member of our testing branch will follow up to get those supplies to those organizations. And lastly, I just really wanted to thank the community for all their interest since we launched the COVID-19 phase 2 interest survey for vaccines as we move into phase 2. We have had a lot of interest from the community filling out that. As of today, we have received over 12,600 submissions from both individuals and organizations, encompassing nearly 25,000 individuals here in Shawnee County. Our interim health officer, Dr. Cooley, will be providing an additional vaccine update later in this briefing, but I just wanted to take the opportunity to thank the community for their interest and be on the lookout for the additional communications to come out about moving into the phase 2 and vaccine in our community. With that, Amanda, I will turn it back over to you. Thank you.
Thank you, Craig. Our next speaker is Dr. Robert Cadady, President and CEO of Stormontville Health.
Thank you, Amanda, and thank you all for tuning in. Our numbers continue to be high. The number of inpatients testing positive for COVID actually jumped from the lower 50s. We've been running a baseline of 51, 52, 53, and gradually trending down in the last week. And we jumped by 10 cases from yesterday. We are now up to 61. I'm not sure hoping that that is not a trend, not sure the cause. I do know that most of those patients did come through our emergency department, were not transferred in from other facilities. So we'll be keeping our eye on that. Our capacity, we're at 95% of our medical beds in use and 96% of our intensive care beds occupied. Our testing positive rate, again, these are symptomatic patients being tested, running a little bump up at 21.3%. And we had 60 people yesterday test positive. Again, after seeing a trend downwards. So I don't want to make this to be a trend. It was a single day's numbers that seemed to bump up, wrong direction. And again, we are not confident we know if anything is going on in that or not, but we'll be keeping a close eye on it. We continue to have a number of team members out due to exposure. That number seems to be trending fairly stable, and we have not given any additional vaccines since last week. We've given a total of 8,076 vaccines to date. We believe that the vaccine clinic that we have set up can reasonably and safely care for about 2,400 people a day, so 2,400 vaccines per day. We are very eager to assist the work as we move into phase 2 of the vaccination process. We have not received any vaccine yet. We have no information about how much we might receive. We are trying to develop some plans and scheduling procedures that will respect everyone's need to get in and get the vaccine and allow us to proceed orderly through those that are in phase 2. We'll be in planning and working closely with our county health department, with the other vaccinators in the community, including St. Francis, to make sure we are able to deliver those vaccines in a safe and orderly fashion. And we are very eager to get started with it. We have vaccine information on our org website, at stormontvale.org. And you can also access our hotline for vaccine 785-270-0675. We will update those resources as soon as we know more, and would just encourage our community as we move into phase 2 to realize there is a constraint on how many we can do every day. And while we're all eager to get those vaccines into patients, let's also have a measure of patience and respect for each other so we can get it done orderly. So thank you. Appreciate the opportunity to be here.
Thank you, Dr. Carnegie. Our next speaker is Steve Anderson, CEO of University of Kansas Health System, St. Francis campus.
Thank you, Amanda, and good afternoon, everyone. We're continuing to see consistent numbers of emergency department visits related to COVID, and our outpatient positive numbers are remaining steady as well. However, on the inpatient side, we have reached our lowest levels in several months. We've been in the mid-20s for the past several weeks, mid-20s as far as the number of positive inpatients is concerned, and now we're down to 11 positive inpatients today. So again, one day doesn't make a trend, but we're happy to see that number decline and hope that will continue. The number of our staff isolating is declining and actually hit single digits earlier this week. I think we were down to 8 a couple days ago. Today we're at 14 staff isolating. On the vaccine front, nearly 70% of our staff have received at least 1 dose of vaccine. And as Dr. Carnegie was talking about, us as a state now, Kansas being in phase 2, we're now able to begin offering the vaccine to our clinic patients who are 65 years and older. So today we're communicating with our patients, our clinic patients, through text messaging and also through the MyChart app. And so patients who would like to request an appointment should complete the request form located at kutopeka.com/coronavirus. We've established our vaccination center in our outpatient facility located at 8th and Fairlawn, and we will begin vaccinating at this location by appointment tomorrow. An appointment is required, and we will be giving a limited number of vaccines tomorrow. Of course, the supply of vaccine that we receive from KDHE will determine how many appointments we'll continue to be able to schedule. So we're beginning now on a limited basis tomorrow. We urge you to continue to take precautions. The vaccine is just one way to slow the spread of the virus. So we encourage you to continue to wear a mask and physical distance and avoid large gatherings and washing your hands, and stay home and call your doctor if you're sick. Don't be afraid to come to the hospital though. We are here to serve you, and look forward to doing so as we have in the past. So thank you very much.
Thank you, Steve Anderson. Our next speaker is Dr. Cooley, Shawnee County Health Interim Health Officer.
Thank you. I'd like to give a little update on our vaccine situation in the county. Thus far, we've given over 15,000 doses. That's both first and second doses to our phase 1 individuals. This number does not reflect, though, how many of the vaccinations have been provided to our long-term care facility staff and residents. Those are the groups that opted for the federally directed pharmacy programs, and we do not have data on that, but you can rest assured that the county has given well over 15,000 shots then. The state released us to begin phase 2 vaccinations. We are continuing to get information from KDHE on phase 2 implementation. We get this daily, essentially. And so this is rapidly changing, and I hope everybody appreciates that we're getting the information constantly, and this is making some changes that we've been having to make in order to implement our phase 2. We've been meeting over the last few weeks with our community partners, and we have plans in place for phase 2. We have a survey list for people to sign up if they're in phase 2. Craig mentioned this. please complete this, and someone will be contacting you concerning the immunizations as soon as we have more information on scheduling options. We will concentrate initially, I think, on our 65 and older age groups and our first responders, police, fire, etc. But I want everybody to understand, we plan on providing vaccine to all those in phase 2. So please, just like Dr. Carnegie said, have some patience and understand that we will do this as fast as we can. We have a clinic that's scheduled for today. I think it's at 2 o'clock, and this will begin some limited phase 2 vaccinations. And we also have one scheduled for tomorrow. Both of these are at the Ag Hall. We are not conducting COVID vaccinations at the 10th Street Clinic, so please don't show up there thinking that that's where you're going to get your immunizations. We will continue to collaborate with our hospital partners to assist in administering vaccine to individuals that are outlined in our current phases. And I really want to thank them for all the assistance that they have given us in making sure that we are vaccinating the members of our county. We'll continue to vaccinate phase 1 individuals too, and we're going to finish up not only with those that maybe missed their initial doses being in phase 1, but also finish up on their second doses. So I don't want people in phase 1 to think that, oh, we're jumped to phase 2, so now they're going to be forgotten, because they will not. KDHE currently is not receiving a large amounts of the vaccine to allocate to us. They get their vaccine from the federal government, and then they allocate it to us. And not only us, obviously, it's to other counties in the state. And so the number of individuals that we and our community partners are going to be able to schedule to immunize really is going to be dependent on the amount of vaccine we receive weekly from KDHE. And right now, to be honest, it's not large amounts. So we will have some limitation in how we are able to schedule vaccinations. Just like Mr. Anderson and Dr. Carnegie said, please be patient on that. We will get it as fast as we can. The number of clinics that we and our community partners can schedule also is going to be limited somewhat by staff numbers. For example, how many vaccinators can we get? Volunteers are very important, certainly, in helping us in these clinics. And quite frankly, what other resources that we need and able to provide these vaccinations. Those all are going to limit how fast we can get the vaccination into people's arms. We expect that the allocated amounts of vaccine from the state will increase in the following weeks. So that's another positive sign I hope people understand. We've been told that in the future, pharmacies and physician offices will begin receiving vaccine, and we'll be able then to also provide that. And I just want to also just remind people, counties in the state will be doing phase 2 differently. That's going to be based on the number of population that want the vaccine. It varies throughout the state. It's going to depend on the amount of vaccine that they receive, and it's also going to depend on what resources they have in their counties. And so the counties are going to be different, and I hope people understand that. And counties are going to move through the different phases probably on a different timeline than the other counties. So these are all things to remember, that we aren't going to be exactly the same as maybe surrounding counties or other counties in the state. And I think that's all I had. So thank you, Amanda.
Thank you, Dr. Cooley. Our next speaker is Honorable Michelle de la Isla.
Forgive me as the press conference is starting and my dog decided that he wants to speak on my behalf as well. So first of all, thank everybody. I thank everybody for their concern about my health. I have been bombarded by the kindness of so many people. And I want to really just say thank you to my team of care over at Stormont Vail. It's been really a story of 2 clinics. On Friday, when I got extremely sick, we needed to make sure that I had the test. And even though I did a PCR test, I went in immediately on Saturday because my symptoms kept worsening to KU St. Francis because they have the rapid test. The rapid test came out positive. The care that I received there was wonderful, but that allowed for my personal doctor, Dr. Willingham, who was amazing and still is amazing to provide care for me. I want to personally thank Stacy and Jamie Ganson, who are the nurses that call me every single day to ensure that I am doing well. And just use this opportunity as a moment to remind our community that we are to take care of those who are the most vulnerable in our community, who are those individuals that are considered essential personnel, especially those who are not able to work from home like I have the privilege. A few weeks ago, my parents came from Puerto Rico, and my sister and I quarantined, stayed away from everybody so that we could have our Christmas celebration together with them. And even though we did everything right, my sister let me know on Wednesday last week that she had lost her sense of smell and her taste. And I was doing great until Friday when I had a really bad episode. So be careful, be cautious, be mindful. Even if you're doing everything right, you just don't know. So make sure that you are taking all of the possible precautions so that none of you have to go through this. It has been a pretty difficult journey. And I seldom get winded when I talk. And as you can tell, I'm struggling a little bit. So we'll get through this. Just take care of yourselves. Now with that, I want to make sure that I pass on to the Spanish portion of this presentation. So if you would allow me a second, I am looking for Craig's talking points, and I will start talking in Spanish. Primero que todo, quiero agradecerle a todo el mundo que me ha llamado, que me ha dado cuidado porque se enteraron de que tengo el virus. Mi doctora Willingham, ha sido maravillosa, al igual que Stacy y Jamie Ganson, y también Evan, que fue mi contact tracer, fueron maravillosos. A Dios gracias, todavía soy un poco corta de aire, pero estoy mucho mejor. Pero le pido a todos que por favor, miren, mi hermana trabaja en un banco y me llamó miércoles que tenía síntomas, y a pesar de que no estábamos viendo a nadie más que nuestra familia, resulta que ella fue infectada primero que yo y luego yo salí con síntomas. Así que tengan cuidado, quédense en casa, lávese las manos y use su mascarilla. El señor Craig Barnes reportó hoy que el total de casos que han pasado a través del condado son 2,602 casos, y esto incluye los casos de esta mañana, y eso es solamente para el mes de enero. Esta semana hemos tenido 454 casos reportados y esto incluye 82 casos reportados al día de hoy. Estamos teniendo un promedio de 124 casos al día de las últimas 2 semanas. Ayer nos asignaron 161 casos y esto ha sido el número más alto de casos en los últimos 12 días. En adición, disculpen que mi perro está ladrando. En adición, tuvimos 2 muertes que se han añadido y los números se cambiarán esta semana. La puntuación que tenemos para el condado bajó 4 puntos de 23 a 19. Nosotros todavía estamos sin control de la pandemia en nuestra comunidad por 12 semanas consecutivas. Luego de esta semana se han diagnosticado, hemos visto un aumento de 33% casos diagnosticados en las últimas semanas. Este número es muy alto, ya que tenemos un nivel de 750 casos por semana. Hay mucha presión en los hospitales, todavía están a un número alto, y la semana pasada se reportaron 21 muertes. Todavía estamos colaborando con la ciudad de Topeka para poder llamar, y también en adición a eso estamos todavía haciendo nuestras pruebas en los lugares indicados, que es en Mount Zion, en la biblioteca y también en Hummers Park. Mantendremos estos locales abiertos de lunes a sábado de 9 a 5:30 de la tarde. Eso es una prueba completamente gratis, no tiene que tener plan médico, y en adición a eso es una prueba de saliva que no le tienen que espetar nada de la nariz. En adición, también hemos proveído por esta opción, tenemos una una pacta con el Estado y también estamos ayudando a empleados. Entonces, el doctor Robert Kennedy habló sobre que hay muchos pacientes todavía positivos, han brincado de 51 a 52 casos positivos por día. Ayer tuvieron 61 casos y él espera que esto no sea lo que nos sigue, pero eso fue lo que pasó hoy. A este momento, Stormont Vail tiene 95% del hospital ocupado y 96% de las camas de cuidado intensivo. El monto de pruebas positivas ha subido a un 21% y 60 personas dieron positivo ayer. Están viendo, estamos en la segunda fase y le estamos pidiendo por favor que tengan paciencia. Nosotros estamos dando las vacunas de acuerdo al número de vacunas que tenemos disponible. Así que por favor tenga paciencia con sus médicos porque hay muchísimas personas que quieren vacunarse. El señor Steve Anderson nos deja saber que ha visto muchísimos casos que están igual que en Stormont Vail entrando por la sala de emergencia, pero el número de personas hospitalizadas ha bajado muchísimo, de los número 20 a 11 personas. Han visto el número de empleados que está en isolación bajar de 14 a 8. 70% de sus empleados tienen la vacuna. Y también empezaron la fase 2 de las vacunas. Ellos están utilizando la página kutopica.com, coronavirus, y mañana van a tener una clínica en la calle 8 y Fairlawn, y es solo por cita. Entonces, está también pidiéndole que por favor recuerden que todos estamos dando la vacuna basada en qué vacuna está disponible. Los números de vacunas son muy transitorios, ya que dependemos del Estado, el Departamento de Salud del Estado, a que nos dé las vacunas. Les recomiendan también que use la mascarilla, que mantenga su distancia. El doctor Cooley nos indica que hemos dado 15,000 vacunas y que seguimos mañana proveyendo vacunas a las personas. Le pedimos por favor que tenga paciencia. Mañana va a haber una clínica para vacunas solamente a medida de que recibamos la cantidad de vacunas disponible. Es por cita y esto es basado en el número que tenemos semanalmente de vacunas disponibles. Así que les rogamos paciencia. Les rogamos paciencia y que entienda que tener una primera vacuna no es equivalente a que tenga inmunidad. Necesita las 2 vacunas. Y recuerde que vamos a tener muchas personas que van a estar pidiendo la vacuna. Llene el formulario del departamento del condado, hable con su médico primario de cabecera y con sus hospitales, pero tenga paciencia, por favor. Estamos haciendo lo mejor que podemos con los recursos que tenemos. Con eso, muchísimas gracias. Finally, I did forget to thank Evan. He was our contact tracer. And he also was amazing. So thank you all to our community. Our healthcare professionals are phenomenal. And I am very grateful for that because I am the beneficiary. So that would be all.
Thank you, Mayor Michelle de la Isla. Next, we're going to have Dr. Cooley come back on and address a Facebook question that came up.
I don't see it, Amanda. Do you?
The question was about in phase 2, at any age, are teachers eligible for that?
Yes, yes. All teachers should be, despite age.
Thank you, Dr. Cooley. Now we're going to go ahead and open it up to our media partners for questions. Who would like to go first? Blaze with the Capital Journal.
This question is for Dr. Cooley, but it's actually for Dr. Cooley in his role as the chair of the Health Advisory Board with the county commissioners. I know they were interviewing a candidate for the health officer position today. Do you happen to know how many candidates total the Health Technical Advisory Board had recommended to them?
We had sent one recommendation.
Would you be able to comment on if it was that person today, or would you not know?
That's currently in negotiations right now, I think, with the individual that we had recommended. And so I really can't speak on anything more about it.
This is, I guess, either for Craig or Dr. Cooley. Craig, you had said over 12,000 individuals and organizations had submitted for getting vaccinated during phase 2. Do you have a breakdown of just how many individuals and organizations applied, and, like, I guess, the demographic of those individuals?
I don't have that at my exact disposal. What I can tell you, so we had the 12,600 submissions. It was roughly about 12,000 individuals. So if you extrapolate that, while we're talking out 600 different organizations for an additional 12,000 individuals. So, but yeah, that's what we've received so far as of earlier today through that interest survey.
Okay, thank you.
And then I think this question may be best directed towards Craig or Dr. Cooley. Either one can field it, but I think it was the last press conference we had seen that big spike in cases, which were attributed to the holiday spike. When does the county know that they've moved beyond it from a case standpoint? Obviously, hospitalizations will lag behind, but when do we know we've passed the spike in cases from a holiday standpoint?
So I can start us off there, Dr. Cooley. I think, you know, the data that's coming in now is kind of what we're looking at to determine whether or not we've kind of gone back to that plateau that you had seen previously with around 800 to mid 800s in cases. So we could be reaching the end of that. I think time will still continue to tell. This is why we don't look at data just on a daily basis, and we take a look at the full trends. So cases could become trickling in. I think you've heard some indicators today. We don't want to think too far into the head, but maybe we can see some cases that are coming up here right now due to the increased number of cases that we saw come across the health department that were reported to us yesterday, and some of the increases in hospitalizations. So I think time will tell. I think it's too early to make an assumption at this point in time whether or not we have hit that plateau or if we'll see another spike. I think next week will probably be a better indicator, if you will. Dr. Cooley, anything you'd add?
No, you covered it. Usually we think of after these events that you got about a 2 to 3 week period where you're going to see the effect of it. This was an unusual holiday because you had kind of a double holiday a week apart. And so we may be still seeing some of the effects of that. But generally it's about a 2 to 3 week period after the holiday that you expect to see the surges.
Dr. Cooley, you had said that you had said that for phase 2, people over 65 would be prioritized first. Can you go into more details about who within that 65 and up age range are being prioritized for vaccine?
I think right now it's just everybody that's 65 and older, I think, is what most of us are looking at. And when we're prioritizing those, I think you got to understand that we're going to be looking at other groups too. The 65 and older group is a very large group, and you know, I think to try to do all the 65 and olders and then do other members that or other people who are in phase 2, I just don't think that's probably going to be very efficient. So we will probably be trying to do certain groups in addition to the people who are 65 and older. Craig, you want to add anything?
Yeah, the only thing that I would add to that is, so when we look at the phase 2, that's a very large, as Dr. Cooley kind of alluded to, is a very large number of individuals. You know, the forecasting models that we have done preliminary to look at this includes anywhere from 55,000 individuals to 65, maybe even up, you know. And so we're still continuing to look at that and what it is. So you know, as Dr. Cooley is alluding to, I think we're going to do this as kind of a layered approach. You know, we won't just do 65 and older first. We're going to be targeting some specific groups as well in our community. As Dr. Cooley had alluded into his speaking pieces earlier, we are starting into phase 2 with a vaccination clinic today and tomorrow that is going to be targeting first responders, law enforcement officials as well. And that will continue. And so the other piece to make you aware of as well is, as we move into phase 2, that doesn't mean if you missed your vaccine in phase 1 that you're out of the running. So we still have to pick up individuals who, for any number of reasons, may have not received a vaccine as part of the phase 1 pieces and the clinics that we have already done. So it's going to be a process. It's going to be slow. I think Dr. Kanagi and Mr. Anderson also touched on this briefly, is still trying to determine what our weekly allocations are going to be. And so once we're able to get a firmer grasp of how much vaccine is going to be coming into our community, we're going to be able to determine a little bit better those clinic times, scheduling folks, and how quickly we're able to get this. But this is going to be a long process. We're looking at doing this over several months. And so I, again, want to reiterate what I think most people have said on this call today is have a little bit of patience. You know, we will be making contact. I know one of the questions also on Facebook was, how would people be notified? And so if you filled out the interest survey, once, you know, those groups come up and we're able to get information out on or receive vaccine, and we are able to get vaccination clinics scheduled, we'll be pushing out information to those groups. So I would encourage individuals to watch the news outlets, watch social media for all the partners. And also to mention here, I think, is this is a collaborative effort. Nobody is working here in an individual silo. We're all working together collaboratively, the health department, Grace Med as our FQHC, the hospitals, to ensure that, you know, when vaccine allocations come in, that vaccine is then getting into the arms of the individuals in this phase who need it. So hopefully that answers your question there, Kim.
Yeah, and just double checking, you said that the vaccine clinic for phase 2 at Ag Hall, that's happening right now?
Yes, it started at 2 o'clock today. Individuals, that was for law enforcement and first responders. So we scheduled those specifically with those individuals. So those folks who are going to be coming through those clinics today and tomorrow have already been notified. This is not a walk-in clinic.
Got it. Okay, thank you.
Mm-hmm.
I think this is probably a question best suited for the hospitals, but I have a feeling that a couple people may want to pitch in here. It's about vaccine and how much is around and how many people are getting the shots. Because in Stormont Vale's COVID-19 updates, I think on the 16th, they had 8,076 shots. And as Kanagi mentioned, they really haven't given any shots since then. I might have missed it, but is there any particular reason more shots haven't been given since that date?
Yes, I can speak to that directly. It's because we don't have any vaccine. Once we receive an allocation of vaccine, we will begin giving shots again.
And it does not look like we have any more questions from our media partners. So I want to thank everyone for joining us. Yes.
Could I just make one comment?
Sure.
A couple of things, and it kind of relates to the vaccines a little bit too, is that as we proceed, I'm afraid that people are going to assume that if they get vaccinated, that they don't have to worry about following our mitigation efforts. And I think that this is really potentially going to be a problem for us. And I also think that most of us, or at least a lot of us, are Chief fans. I know that we're all paying attention, and certainly Super Bowl is coming up pretty soon, and that's going to be a time where we have a lot of individuals having Super Bowl parties, et cetera. And I think we have to be very aware of the fact that these are potentially super spreader events in many ways. And so please, I hope everybody will remember that follow the mitigation that we advise as best as we can. I would hate for us to be making some ground here and showing some trends downward with our cases, and then Super Bowl comes around and then all of a sudden we're right back to where we were a week or two ago. So I just felt like we needed to get this out to the public, that please be aware of the fact that we're not out of this. The vaccine still, while it's certainly, I think, gives us hope, that we're still going to have to be following our mitigation and being very cautious. Thank you.
Thank you, Dr. Cooley, for that final message. Like I said, we are out of questions, and so we're going to go ahead and end our media conference. And I want to thank everyone for joining us, and we'll see you next week. Thank you.